We presented the data in this meeting from the CARTITUDE-2 trial, cohort A, and this was focused on patients with 1 to 3 prior lines and, as you said, refractory to lenalidomide. So following the data from the CARTITUDE-1 trial, which were also actually updated in this meeting, showing extraordinary efficacy in patients who are heavily pretreated after 6 lines of therapy. We're talking about 98% overall response rate, and in a landmark analysis, it was shown in this meeting of 2 years, PFS, median PFS has not been reached, and the overall survival is outstanding. So, as done in Hem-Onc and in myeloma, when we have effective therapies in advanced patients, we move them to earlier lines. And the rationale for this is that with this T-cell redirectional therapy, we think that in earlier lines of therapy, there's an opportunity, since the T-cells are more fit, are less exhausted, we might get a better response and more durable response. So this was the rationale behind the CARTITUDE-2 cohort A. So we presented an updated analysis of these 20 patients enrolled into this cohort. It's a 17-month follow-up, and the overall response rate was 95%, and the responses were deep. We found that over 90% of the patients achieved a CR. All the patients who were available for MRD were MRD negative. The median PFS has not been reached yet. In the cutoff point, 70% of the patients remained progression free. So these are very encouraging data. Safety was manageable. As far as CRS, most patients had CRS, but they were mostly grade 1, 2, and controllable with supportive care. There were 3 cases of ICANS, but they were transient and manageable. So I think this is really favorable, encouraging data, and we will of course keep following these patients. There is the CARTITUDE-4 trial, which is ongoing, and this is a randomized trial in a similar patient population, comparing Cilta-cel to a combination therapy with triplets. So that will also, of course, provide us interesting data, and we're looking forward to seeing that.